Warm greetings. I'm Monica Diaz from the World Health Organization Global Tuberculosis Program. I lead the work on multi-sectoral engagement and accountability, on TB elimination, on our DG flagship initiative, and on public-private mix or public-private partnerships. It's a real pleasure to be here today at the union's this union special virtual event to mark the occasion of World TB Day. So I'd like to quickly share with you our perspectives basically on making the vision of a TB-free world a reality. So let me quickly go through the presentation. So the main focus, of course, as you all know, WHO reported last year that for the first time, TB incidence went up, mainly due to the COVID-19 pandemic impact. We reported the year before that the TB deaths had also increased. This has set back progress by decades. So to make a TB-free world a reality, one of the first steps is to get the TB response back on track. For this, of course, there are several steps needed. We need high-level leadership, and we have the opportunity of the UN high-level meeting coming up. We need to make sure that there are rapid uptakes of policies and recommendations, and we need to support countries, especially to help them strengthen their programs and accelerate the TB response. So here I'd like to just quickly flag that WHO plays a leading role in health. We are working for better health for everyone, everywhere, including those ill with TB. Ending TB is a major priority for our organization, and we have several strategies linked to it, several targets, and of course, it is a priority for our Director General, and he has a flagship initiative that was launched in 2018 that I'll come to in a bit that prioritizes accelerating the response to ending TB. So as I said, we have several commitments. One of the main ones are, of course, in 2018, for the first time, heads of state came together to commit on stepping up the response to end TB, because despite there being the NTB strategy in 2015, the response, the investments still weren't up to par. So heads of state came together for the first time and made strong commitments on ending TB. And here is a very quick overview. We had strong targets of reaching 40 million people with care, 30 million people with preventive treatment, mobilizing financing, addressing stigma and human rights. In follow-up, in 2020, we had a special progress report issued by the UN Secretary General. This was at the heart of the pandemic, asking for, with 10 priority recommendations outlining how the TB response can be accelerated to reach the global targets committed to in 2015 and 2018. Now we have the opportunity again this year for the second UN high-level meeting, which will be held on 22nd September, and bring together heads of state for the second time. We have Uzbekistan and Poland who are co-facilitators, and there will be a multi-stakeholder hearing that will bring together civil society and other stakeholders in May 2023. So this is another high-level opportunity for leadership if we want to make ending TB a reality. This very quickly is a roadmap of all the activities spanning back from 2018 and all the activities happening this year to the lead up to the high-level meeting on 22 September. And WHO has been requested to play a strong role. So this week, our Director General announced the expanded scope of the flagship initiative to basically cover 2023 to 2027 with an expanded scope of targeting universal access to TB prevention and care, advancing research and development, and strengthening multi-sectoral response or multi-sectoral engagement and accountability. And there are new targets which are very much aligned with the NTB strategy that have been announced and spanning 2023 to 2027. And we hope that these guide the intergovernmental negotiations as the declaration for the second high-level meeting progresses. What we also need to do in the lead up to the high-level meeting is encourage highest level participation from heads of state. There are 3 high-level meetings happening this year, and it's really imperative that we get the commitments that we need. In terms of preparations, one of the important steps for us has been high-level reviews of progress. This is an important step. At the 2023 high-level meeting, where heads of state have to report back on what has happened since 2018, the progress made, and so that they can prioritize next steps. Very quickly flagging that this is what we expect, the national high-level reviews by heads of state. And a link to this, among all the steps that I mentioned, of course, high-level leadership is imperative. I'd like to just pick on one point among all, which is the importance of multi-sectoral engagement and accountability. As you all know, TB is not just a health issue, but a social issue, an economic issue. It spans across all the health sectors. So it's really critical that when we look at the patient pathway, that our work spans across all the SDGs, from social support to financing, addressing the issues around poverty and around undernutrition, all of these that are really the key drivers of the epidemic. And the COVID-19 pandemic has really exacerbated the situation. And so multi-sectoral action, engagement, and accountability is key. So there are 4 components of WHO's multi-sectoral accountability framework that was released in 2019, which really maps the way forward for countries on how to move from commitments to actions, monitoring, reporting, strengthening accountability, reviewing, and then back again through the cycle to make sure that there is a strong prioritized TB response in countries that addresses the epidemic as a whole, not just as a health issue, but beyond health as well. I'm quickly outlining all the work that's gone into this area of multi-sectoral engagement and accountability from the time in 2019, from the launch of the multi-sectoral accountability framework, to we've developed several tools to help member states implement the multi-sectoral accountability framework, from baseline assessment checklists, documentation of best practices, and operational guide, to supporting national program reviews, consultations in the development of coordination and review mechanisms, and the like. At the global level, we have a multi-stakeholder and multi-sectoral platform, bringing together UN agencies, the civil society task force, and partners, as well as all 3 levels of WHO, to basically help with the preparations for the UN high-level meeting, as well as advance multi-sectoral engagement and accountability, which is going to be a very core step if you're looking to end TB and making a TB-free world a reality. So I'll quickly touch upon one more point. Again, a lot of the focus is on high-level leadership, multi-sectoral engagement, and we really need to unite forces to advocate as much as we can at global level, at regional and national level, because we need all hands on deck to ensure that we make the most of the opportunity we have this year with heads of state coming together for the high-level meeting, to basically commit on multi-sectoral engagement and accountability through MAF-TB implementation, through strategic dialogue and advocacy, and making sure that we have a strong political declaration with key targets, and with good head of state participation in our event, to make sure that we have those commitments at the highest level backed by investments, which can then translate to action across all levels in the country so that it reaches those very much in need, those affected by TB and their families. So of course, this is a very small piece of the whole. There are several elements when we look at ending TB and making a TB-free world a reality. And I've just touched on one piece of the puzzle. I would say there's much more to be done, of course, but looking ahead, we have several high-level opportunities this year, from the flagship to the high-level meeting. We have on R&D and new vaccines, we have a Vaccine Accelerator Council. We need to mobilize young people. And I'm flagging here quickly a WHO 1+1 Youth Initiative. All of these elements are really critical when we are looking at ending TB, bringing everything together, using this year as that impetus for action so that we can end TB by 2030. So today's World TB Day, we commemorate this day and we stand in solidarity with the millions who are affected with TB and pay tribute to those who've lost their lives from this preventable and curable disease. Yes, we can end TB. Thank you.